Okay. We were asked to present on the road to legislative reform in New Zealand. This process has been going on for at least a decade, and it's been a cumulative process. It was started by Murray Laugesen in Christchurch, and it's grown from there. It's become an academic thing, it's become a scientific thing. However, the vapors of New Zealand, the consumers, were never really officially or formally organized. There was a group of us in Wellington who were fighting the city council because they wanted to include vaping in smoke-free laws. We knew it wasn't in the smoke-free law because obviously when that law came out, vaping didn't exist. So what we did is we contacted them and we barraged them with information. They still went ahead and did it, but again, they instituted a bylaw that they couldn't enforce. Very similar to the law about nicotine e-liquid in New Zealand. It's illegal to sell at retail. You can import it for personal use. You can still buy it on the black market because there's no way to enforce the law that says it's illegal. Luckily for us, within about 18 months, it will be legal to retail nicotine liquid, e-liquid. This, of course, the caveat of that is if the government doesn't change in September when we have an election. So, what did I do? I killed it, okay. Before I go on, I just want to state one thing. The legalization process that is happening for e-cigarettes, e-liquid, nicotine e-liquid, and alternative tobacco products, it's a consumer product. It's not a medical product, and that's a very important point, obviously, so we'll carry on. I think I'm going to be attacked. When we decided that we were going to get involved with this on an official level, the group of us sat down and said, well, how are we going to do this? Who are the people that are involved? Who are the people that need to know what's going on? And how are we going to facilitate this? Because we ultimately think of ourselves as facilitators, okay? Even though we're representing the consumers, we're facilitating between the consumers and scientists and academia, the vendors as well, and the Ministry of Health and MPs. So when you look at this graphic, those arrows, that's AVCA, okay? And if you notice, they go back and forth. So we talk to all of them. We engage with everyone. We share information because we always felt that the more you know, the less somebody can put one over on you. Educated consumers are the scariest thing for somebody who wants to tell you not to do something. As everyone else has said, if somebody tells you you don't want not to do something, you're going to do it, okay? And if you're going to do it, be smart about it. Know what you're doing. One of the things that has enabled us to be effective is with our engagement and how we have approached it. When we sit down with people from public health or people from healthcare like the Modi Health Service, or even smokers who come to us and say, you know, what's this about? We listen. 9 times out of 10, communication is the problem. And I think everybody's heard this like 5 times, 10 times already today, okay? Communication. Part of that is actively listening. Part of that is having your mind open and not being judgmental, you dirty smoker, or, you know, you horrible meth user, okay? We don't do that. There's no judgment with us, and we've always been that way. And we've been that way with the government, and we've been that way with people who are rabidly anti-vaping, okay? As hard as that may seem, if we sit and we listen to what they're saying, we can find out where they're coming from. 9 times out of 10, when we've spoken to people who are anti-vaping, they're former smokers who quit the hard way. And 9 times out of 10, they're actually resentful that we had an option that they didn't have at that time. Our priority has always been to be inclusive, okay? Our priority is to collaborate. Not all people want to collaborate. Not all people want to work with us. That's fine, but we always give them the choice. Because by giving them the choice, then when they come back at us, hey, the door's still open, but you know, here's how we're going to do this. Devising solutions, okay? If you look, stakeholders being the government, the vapors, the smokers, the healthcare professionals, even the tobacco control people and the public health people that are against us. They all have concerns. We don't dismiss them out of hand. You need to understand what you're dealing with and who you're dealing with in order to be able to talk to them, okay? We provide solid supporting evidence. We ask for solid supporting evidence from people who are against us. It's not sufficient to give me an article from CNN that you've pulled off the internet and say, well, there's my evidence is you're wrong. I'm sorry, that doesn't work. Then you hit them back with the real science and the real evidence. It's a matter of, as other people have said, countering opinion, give me science, give me evidence. And we spend a lot of time doing that. But it's worked, because by doing that, we've proven our own legitimacy. We've proven that we're not just here, we want to do this because we want to do this. Well, yeah, we do, but science is on our side. Policy precedents. New Zealand's very lucky, because we can look at what has happened in the United States, we can look at what's happening in the EU and say, we don't want this to happen here. Luckily for us, in engaging with the government, they see the problems as well. So we won't, hopefully, won't make those same mistakes. Being realistic and being feasible, okay? It would be nice not to have any legislation whatsoever, but you know what? That's not really feasible, because there is always that possibility. As it is now, to a certain extent, we've been very lucky. No one has been harmed. No one has had any real negative impact from vaping in New Zealand. But it's only a matter of time. And you have to be aware of these things, because the more people get online and the more people start to utilize this for whatever purpose, be it recreation or to, switch, okay? Education is key, okay? But in order to be able to educate and have them listen, you need to have something behind you. I mean, many times we said to people, well, that's probably not a good idea. Well, you can't tell me what to do, and nobody should tell me what to do because there's no legislation, until the first time something goes wrong. And then they'll be like, well, okay. Effective collaboration. Clarity, communication, common ground. I think that's pretty self-evident, okay? Know what you want. Okay? Know what you need. What you need tends to carry more weight than what you want. But be very clear about that. Be very clear with yourself about the difference between what you want and what you need, and be very clear with other people about that. Find common ground. Believe it or not, with most people, if you spend enough time, you will find the common ground. And you build upon that. That's your foundation. So far, okay, what we have managed to do, and this is interesting, is the government has come to us. We didn't expect this. We got a phone call. Come into Wellington. We were like, okay. Went into Wellington, sat down. They said, okay, talk to us. They asked us to talk to them. We were shocked. We spent 2 hours there. We came out with a list. They said, we need this from you. Okay, went out, got the information that they needed, went back to them, gave it to them. They wanted questions. It became this thing where they came to us. And it was kind of shocking and scary, but it opened that door. And once that door was open, it was like manna from heaven, because it was like, now I can ask you, why do you think this? Why is this like this? And we were able to engage, and we were able to collaborate, and we were able to communicate. Okay, and we've gotten to the point now where they understand, yeah, it's a consumer product. We don't need to medicalize it, because if we medicalize it, now we're restricting it. Okay? They understand that making it a consumer product means that they'll be able to reach their policy goal of smoke-free 2025. They understand that through we have a program, it's called Vape It Forward. Pretty much we loan equipment, we started out by loaning equipment to people so that they could start to vape. Now it's morphed to a situation where working with the vendors, somebody can go to a vendor and buy a kit on lay-by or layaway, and they can get it at a discount. We have increased the number of smokers in provincial New Zealand where there really aren't any vape shops, massively. Okay, we have a program in one of the neighborhoods or provincial area north of Wellington where we had like a 40% indigenous or Māori smoking rate. We had people come in. We had 300 people come through that program. Okay, out of those 300 people that came through that program, 275 of them switched. Okay, they got off combustible tobacco. And people were shocked, well, how did you do that? Well, because we actually supported them. We said, we gave them, people would mentor and they would be a buddy, okay? You'd have my card. You need help, you call me. You text me. You want to meet up? We'll meet up. It's the support thing. Not to Not to denigrate the old model, okay, because a lot of what we do is based on the New Zealand quitline model. The problem was they limit it to 8 weeks or 12 weeks. Well, you know what? You can't limit it because everyone is different, okay? You need to make it to fit the person in the situation that they're in, okay? I think the longest we've had somebody on the program was 3 months. That's fine, you know, but it's a success because now they aren't smoking cigarettes. We consider that a success. And I'm done now. Thank you.